Hi, I'm Mary Fulforth. I'm the clinical team leader for Acute Physiotherapy and Occupational Therapy. I'm really excited about the launch of the new electronic patient record system coming this summer. And here I'm just going to show you a quick video of the AHP workflow. I've just logged on to Cerner Millennium as an AHP, and here I have my Ward C6 patient list. To have a look what patients have been referred to physiotherapy or other AHPs, I can go into my multi-patient task list in the top of the grey bar up here. Here I can see that Suzanne Brown has got a couple of referrals, one to occupational therapy, to physiotherapy, and another to physiotherapy here. So to go into that and accept it, I will double click, complete the referral form in all the yellow fields. We'll be on a falls pathway and sign it up there. So I've accepted that referral now for Suzanne Brown. What I'll then do is go into my AHP therapist work list and open up Suzanne Brown's case notes. Here I can see all of her details at the top in the blue bar, and all the demographic details, where her location is in the hospital. What I'll then do is I'll add Suzanne Brown to my own therapy work list in the top left-hand bar at the top here. Click on patient, add patient to my own work list. And if I go back to AHP therapist work list and select Mary's work list, you can see her here. With multiple patients, I would be able to create my own list for the day of which patients I would like to see. Following seeing the patient, before seeing the patient, what I would do is go in and read their documentation, which is all in a chronological order down here. Have a look at the referral forms, the VTE risk assessments, etc. After seeing the patient, I'll then use the subjective, objective assessment and plan sections to document my intervention with the patient. And set some goals for the patient as well. I'll then create an adult physiotherapy progress note, and that will pull all the information that I have just documented into a progress note, which I will sign and submit. And that then becomes part of the patient's documentation, which we can see after I've refreshed. In the case notes here, as a adult physiotherapy progress note, which is here on the right hand side. To allow me to put a contact on for this patient, I will go back into my multi-patient task list, click on contacts, hit refresh, and I can see down here Suzanne Brown, and again I will double click into that and complete the contact form. So we saw this patient face to face for 45 minutes, spent 5 minutes doing non-clinical tasks. I then discharged the patient because the goals have been achieved. The patient was seen in medicine and at Royal Blackburn Hospital. This wasn't an on-call contact. I'll then sign it. And that's my intervention completed. Thank you for watching. I hope you found this helpful.